Hi, Dr. Scott. I'm Mr. Reggie. I'm a paraprofessional at FGPA Fort Greene Prep Academy, a public middle school in Brooklyn. Kamira, a student at FGPA, has a COVID 19 question. She asks, is it safe to go outside?
The two most important reasons to go outside is to get exercise and to make necessary trips, for example, to the grocery store, pharmacy, or laundromat. Limit the necessary trips as much as possible and reserve that responsibility for an adult in your household. When you go out for either of these two reasons, it is important to remember that you will be among people who do not live in your household. Social distancing is important. Keep 6 feet away from people who do not live in your household. This we must do in stores and in laundromats. You must practice social distancing even if other people will not. Now, let's focus on how to safely go outside for exercise, which is important for everyone. Wash your hands before you leave your home. Exit only with adults who live with you. Choose open spaces and keep away from others who do not live with you. Bring hand sanitizer with you and use it immediately if you touch a surface by accident. Do not play on any playground equipment and do not touch fences. If you play ball, do not share it with other people. And do not play basketball with other people. Do not touch the sporting equipment of others.
We've got a follow-up question from Mrs. Latier, principal of FGPA. She asks, when we return home from outside, what procedure should we follow to make ourselves safe? Should we change and wash clothes, bathe, leave shoes outside?
Remove your shoes before entering your home. Do not walk around your home in those same old shoes that you wore outside. Remove the clothes that you wore outside and isolate them in a special washing bin. Put on clean clothes that you use for wearing inside your home. Wash your hands with soap and water after you change your clothes.
Here's a question from Imaya, a FGPA student. Dr. Scott, I have a really big family. Is it safe for us all to be in the same room at the same time?
That's an important question. Living together as a big family should give you lots of pride. However, it does mean that members of your household must take extra precaution. It is essential that everyone keep the surfaces clean in the household. If possible, only one person should be leaving the home for essential errands like groceries and the laundromat. They should do so with a mask in place. That person should take extra care when returning home by washing their hands, removing their shoes, and putting on inside clothes. It is safe for you all to share the same room unless one of you develops symptoms of COVID-19. Should one person begin to feel sick, it's extremely important to quarantine themselves. It's good to think about this in advance. In which room or space could a member of your household live if they became sick? Make a plan for how you will take care of this person without coming in close contact with them. If this person must share a bathroom with others, keep the entire bathroom extremely clean and do not share towels.
Here's a question from Keith, an FGPA student. He asks, Dr. Scott, why do they call it corona?
To answer your question, you need a microscope powerful enough to magnify a single cell of the virus. It's worth looking at the virus in this way, and you can do that by finding a picture of the virus online. The word corona is Latin for crown. If you examine a single cell of a coronavirus up close, you'll notice it has a halo, which some believe looks just like a crown.
Dr. Scott, we have various COVID-19 questions from FGPA students concerning air and surfaces. Dante asked, should we wear masks? Aiden asked, is coronavirus airborne? And Michael asked, do masks or gloves actually help? And if so, why?
Thank you for asking this very important question. COVID-19 travels on particulates in the air from sneezing, coughing, and spitting. The main reason to wear a mask when you're among people who do not live with you is to prevent your particles from spreading to others, and to a small extent to prevent the particles from others from getting on you. Unless you are in a hospital or a healthcare setting, gloves are really not that helpful in preventing the spread of the coronavirus. It's much more important to remember to wash your hands.
Dr. Scott, my name is Mr. Reggie. I'm a paraprofessional at FGPA. And I have a question too. At what point does the curve allow us to go outside with our friends?
You can go outside as long as you follow the precautions that we reviewed earlier. But I think you're asking about when the government will decide to end social distancing so that we can go to school and hang out with people outside of our household. Unfortunately, no one can answer this question with certainty right now. We do know that the spread of the virus will slow down one day, and that it will be safe for us to socialize outside of our household again.
Here's a question from Miss Evans, mother of Darius, a student at FGPA. How do we talk to our children if they have anxiety about the coronavirus?
We don't want our children living in the dark about COVID-19. We want to make sure the information they receive is correct and honest. Avoiding the truth can make things worse. Parents should interpret the news from reliable sources, then bring it back to their children in a way that is factual and understandable. It's important to find out from them what they understand about this pandemic. Often, kids and even adults get COVID news that is incorrect, and this can be a source of anxiety. If you can't clear up the misinformation right away, tell them so. Ask for time to research the answer yourself. It's important for their well-being that they see you as calm, honest, and truthful.
And last but not least, here's a question from Mr. Singe, assistant principal of FGPA. Can you give us advice about shopping for groceries safely?
Since we must go to the grocery store to feed our families, it's important to review certain precautions. For example, if possible, stock up on food and supplies when you shop so that you don't need to return for at least 1 week. Planning out meals for this week will help with this. If possible, avoid bodegas where the space is cramped and sometimes crowded. Avoid going to big grocery stores during peak hours when too many people are crowded in the store. Most stores are limiting the number of people inside. When you're in line, waiting to go into the store, remain at least 6 feet from the next person. Bring hand sanitizer with you if possible. And remember, do not touch your face with unclean hands. Do not touch things in the store unless you have to. When you return to your home, remove your shoes, wash your hands, change your clothes, wash your hands again, and then put your groceries away. You do not need to disinfect the boxes or plastic containers that your food comes in. You should rinse your produce in warm water. I hope that you find this information helpful. Please keep safe.